Good afternoon, everyone. I'm Deb Santis. I'm the president and CEO of CSH, Corporation for Supportive Housing, and I want to welcome you all to today's conversation hosted by the Compact for Thriving Communities on engaging people with lived experience in system transformation. Before we get started, I just wanted to mention very briefly what the Compact for Thriving Communities is. The Compact is a group of national and local organizations that have come together to work collectively to address the more than 1.1 million people who are stuck in institutional settings, so individuals and families who are living on the streets and shelters, involved in the child welfare system, who are engaged with the justice system, young people who are experiencing homelessness, elderly people who would be better served in the community rather than in institutional care. And so this group of advocates have come together to really focus on that population who would be better served in the community with housing and services. And at the same time, to understand the disproportionate impact of Black, Indigenous people of color who are in institutional settings. As we've come together to frame our advocacy agenda, it's become very clear and recognized as a central tenet to our work that in order for us to advance our mission, we have to center the voices and the experience of people with lived experience in a meaningful way. And so I'm just really excited that we're able to bring this conversation to you today with people who have direct experience navigating different systems and with housing and service providers who are working to develop models for how to meaningfully engage those with lived experience. So I am going to very quickly turn it over to our moderator, Dr. Ayesha Delany-Brumsey, who's director of the Council of State Governments Justice Center, the Behavioral Health Division. And thank you, Ayesha. Ayesha is going to introduce our panelists and facilitate today's conversation. Thank you all again for making time to be part of this conversation.
Thank you so much. And thank you all for joining us. We're really excited to have this conversation with you. We have a really rich lineup for you in terms of our panelists and our speakers. Thank you for that really beautiful kickoff, Deb. So as you said, my name is Dr. Ayesha Delany-Brumsey. I direct the Behavioral Health Division at the Council of State Governments Justice Center. We are a national nonprofit organization that works with communities across the country to improve justice systems and promote public safety and promote and strengthen community well-being. The speakers we have here with you today will share their experience and offer practical strategies on how organizations can transform systems for more equitable outcomes for people with lived experience of homelessness, people with lived experience of mental health conditions and substance use conditions, and much more. And this discussion will be geared towards entities who are looking to involve people with lived experience in their work to play a lead role in designing, developing, and implementing policies and practices that affect people who are in systems. Just a couple of minor housekeeping notes. We've all been on Zoom for a very long time, but it does not hurt to have the reminder. We encourage you to keep yourself on mute so we can minimize background noise, but we do encourage you to ask questions through the chat. We will try to leave some time at the end to answer as many of those questions as we can. And so now what I'd really like to do is introduce our wonderful panelists. First, we have Senior Peer Advocate at Skid Row Housing Trust, Anthony Haynes. He has over 10 years of experience in peer support and advocacy. He oversees a team of six peer advocates connecting veterans and people with lived experience of houselessness, substance use disorders, and behavioral health conditions to housing, preventative care, treatment, and other supports. Alison Lobb is a member of the new probation planning, implementation, and evaluation team in Sonoma County, California, where she implements evidence-based programming to help clients live successfully without experiencing repeated incarceration. She has experience in managing the operation of children's mental health and trauma clinics, as well as performing policy and data analysis, impact assessment, and advancing community collaborative partnership. And then, based in Raleigh, North Carolina, we have Marcella Middleton, who serves as the co-director of Away Home America as a connector, motivator, and survivor. With a degree in social work, she's a Black mom, daughter, sister, and friend, and has advocated for 15 years for youth in foster care and other non-traditional living arrangements. Marcella's advocacy started in 2005 at an organization called Say So, where she worked on behalf of youth that are or have been in substitute care. She then went on to continue work as a social worker, social work trainer, and member of Hope Center's board of directors. Her work on the National Forum of Homelessness empowered Marcella to center her lived experience to help guide the transformation of the youth homelessness system. And lastly, as a mental health advocate, New York City Fountain House advocacy advisor and member, certified public accountant, Christina Sparrock has tirelessly fought for racial and social justice. She participated in both the New York Police Department and Department of Corrections Crisis Intervention Team CIT program, where she educated law enforcement on de-escalation techniques and crisis communication skills when dealing with those in an emotional crisis. This year's in August 2021, Ms. Sparrock created a person-centered intervention training mental health response pilot in partnership with Fountain House, New York City Parks, and Fort Greene Park Conservancy to divert people in crisis in the park from the criminal legal system to treatment and services instead. In 2018, Senator Kevin Parker awarded Ms. Sparrock the Health Award for the New York State Association of Black and Puerto Rican Legislators Caucus, Incorporated. Most recently, she was appointed by the Brooklyn Borough President-elect Antonio Reynoso to serve on the health committee of his transition team. So I'm very excited because these panelists bring an unbelievable depth of experience to this work. So just to begin us, what I'd like to do is start with one question to all of you. And that question is, how are each of you or your organizations that you represent working to include people with lived experience in your own work? I'll start by calling on Marcella to answer that question. Marcella, can I bring you up?
Yeah, absolutely. Thank you, Ayesha. So with Away Home America, we started probably like 3 years ago. Like we've always leaned into young people with lived expertise. And so when I was on the national forum, I remember partnering with Away Home America with other young people with lived expertise on, the mission and the vision and what the core principles should be. And so those things shifted. And then our steering committee, which is the equivalent of like a board of trustees, wanted to reconstitute from having all older adults who, were providers in the field, or just worked in the field on the other side. I don't know what to call that, but the other side, the professional space of the work. They wanted to reconstitute to have 51% young people, so that now we're shifting power from folks that don't know what it's like to live in your car or on a bench or jumping from home to home, experiencing homelessness, making decisions for young people who are experiencing those things. So they transitioned to having 51%. And then the co-facilitators that are on the board, they're like the end all be all of the decision makers. Those positions are only for young people. And we also those are paid positions for all the young people with lived expertise. And then last year, myself and Amanda Ayala, we transitioned from being on the leadership body, which again is the equivalent of a board of trustees, to being the co-directors of Away Home America. So again, here's this piece of like shifting power to young people with lived expertise and the people who have experienced, homelessness, and just being moved around between systems. And now it's just myself. I'm just executively directing Away Home America. And I think a lot of times when I say that, like, it seems like an ego thing, but it's not. I think my position is very like reminiscent of just the concept of shifting power. So it's not me. It could be any young person with lived expertise in my position. But the fact that Away Home America has shifted from like this distrust, and that young people with lived expertise can't fill these power roles and don't have the context or the knowledge, to me being in this role, and our community in this movement to end youth homelessness has really guarded around me to help me figure out what I need to do in this role, and really have partnered with me. And so that's a little bit of what we've done at Away Home America. And I'm so excited because, again, these are not easy shifts, but they're very important to the work that we're doing in ending homelessness.
No, I really appreciate that, Marcel. I don't know if you're aware, but you are off camera. We can keep you off camera if you want, but just so you know. But I do completely agree that your role overseeing or directing this organization is the kind of shift we're also talking about today, and is a real reflection of what it means to shift and share power. So thank you for those opening reflections. Anthony, to you, can I turn to you on that question of how you or your organization are working to include people with lived experience in your own work?
Hello, everyone. Here at Skirrow Housing Trust, it started off as residents trying to put their lives back together. So as we work on ourselves, we need to stay busy. So it starts off by one resident want to, hey, they pitch an idea to case managers, whoever. Can we have this type of group? Can we have that type of group? And then we start volunteering for more and more. And then the trusters realize, like, hey, folks really need something to do and something positive to do. So what better to do than to have them interact with new residents as they start to come into housing and want to put their lives back together. So we are here to help guide. The trust figured out that, hey, they can be the leaders and they can be the interpart to connect the residents to the case managers and so on and so forth, to the property manager. We're here to just show them how it's going to be, what it's going to feel like. So as folks work on themselves within the company, as we house residents, we hire within, because they've been there, they have the lived experience, and now that they're housed and now they're working on themselves, we want to hire them and get them slowly acclimated with getting back into the working field, if that's their choice. Otherwise, they can just stay volunteering or whatever.
Thank you, Anthony. That's great to hear all the different ways in which your organization is working to include people who've themselves been served by the organization as volunteers and as staff. And then Alison, can I turn to you for that question?
Sure. Thanks, Ayesha. It might not be much of a surprise to anyone that the Sonoma County Probation Department is not as far along in doing this kind of work than the other organizations on this panel, represented on this panel. But I'm happy to say that we are trying to incorporate the voices of the people we serve more and more. So far, primarily, it's been through evaluation and monitoring instruments. So we do have third-party evaluations conducted. And so we use focus group and key informant interviews with the people we serve to learn more about how we're doing. And then we also have a couple of programs that use feedback instruments. Our Day Reporting Center conducts a participant feedback survey a few times a year. And then we also have one that we use with one of our evidence-based programs. We're also beginning to include representatives of people with lived experience on work groups. And one example is our Justice and Mental Health Collaboration Program, which I'll be talking about more later. And then our Stepping Up work group, it's a higher level work group, a multi-agency work group, and probation and our behavioral health division of the county co-lead that group. And recently, a few months ago, that group invited representatives from peer support and advocacy groups to join it. And so we still have a long way to go with this effort, but we're actively working to expand it. Our most recent evaluation made recommendations of including more tools to gather client feedback. And that recommendation has been made one of our top 3 priorities in our new probation process improvement work that we're embarking on now. Thanks.
Thank you so much, Alison. We're looking forward to hearing even more about that. Christina, to you, how are you and your organization working to include people with lived experience in your own work?
Thanks, Ayesha. As a person with lived experience, I know firsthand about the challenges that I've faced navigating through the criminal justice, healthcare, and housing system. While some of these systems grant you access to opportunities, and other aspects of the systems can create harm and lead to poor outcomes for those who are unhoused, living with mental health conditions, substance use disorder, and justice involved. To help improve these systems and adjust policies from within, we need experts at the decision-making table, and those experts are peers. So one of the organizations I've been working with is CCIT NYC. It's called Correct Crisis Intervention Training, and we're advocating for non-police response to mental health calls. And one of the recommendations that they made was about shifting power, as Marcella had mentioned. And we wanted to establish a New York City mental health council consisting of 51% peers or experts from Black and Brown low-income communities. This council is critical. This council of experts will help drive policy and best practices in New York City, such as having peer specialists in the ER and psychiatric facilities to ensure that person-centered approaches are used in the treatment, and having grading systems like we have in restaurants, but for having grading systems for the mental health clinic for treating doctors is to ensure that the communities are treating appropriately. Peers should always be at the table. Peers have a purpose because the ones who are closest to the problems are the closest to the solution. Thank you.
Thank you, Christina. That is a great place to end those opening reflections and to kick us off, because I think that is the sentiment that folks on this panel really share. So Alison, if I could turn to you and ask this to start. You work with a pretrial program that gets people with mental health conditions out of jail and into treatment and into supports in the community. How did this get started? And what have been the benefits and the practical considerations of including peer voices in the program development? And whose buy-in did you really need to get to allow that to happen?
Thanks. Well, our Justice and Mental Health Collaboration Program was begun through a grant from the Bureau of Justice Assistance. We got a planning and implementation grant. And then a few years later, we also got an expansion grant, a JMHCP expansion grant to add more community supports to the program. So the people we serve are involved in the criminal justice system. They have acute mental health impairment, and they also might have substance use issues, and a large proportion of them do not have stable housing or are unhoused. So our current JMHCP, Justice Mental Health Collaboration Program project includes being screened for mental health and substance issues in the jail, getting a discharge plan created and presented in court so the judge can make the decision to release the individuals before they're, at arraignment and before their case comes to trial, a warm handoff to community providers, case management and resource navigation in the community, including mental health treatment and filling other needs. And then we also have a supportive transitional housing facility with 8 dedicated beds, and the house can accommodate people of any gender. So I'm a member of that program planning, implementation, and evaluation team that you mentioned. And my role in the program is project coordinator. And a best practice in program implementation is to have an implementation team made up of stakeholders, including representatives of the client group. So we set one up. And I encountered no resistance. I'm happy to say I encountered no resistance, including voices of representatives from the community on the team. And in fact, the other agencies involved in my leadership helped to identify people to invite onto the team from those communities. So the team consists of 15 people, almost all of whom work for a county government agency or a community-based organization. But currently just one of our team members does not work for an organization and has lived experience, prior experience in the criminal justice system, living with a mental health disability, past substance use issues, and experience being unstably housed.
So then we also have 4 members who do work for organizations, but also have lived experience either personally or as family members of people who've had that experience. It's been really, really wonderful to have members with lived experience on our team. And it's been especially helpful to have a member whose life experience is so similar to that of the people we serve and who does not work for any of our systems. So we've gotten great perspectives and input on program development, developing outreach materials, adopting language that is clear, simple, non-judgmental, and non-stigmatizing, and just learning more or being kept apprised of the situations facing the people that we serve. So those were a bunch of the positives, the benefits, and I would say some of the considerations now. I really wanted all members to be welcomed as equals at the table, and I wanted the time of each of us to be valued as equally as possible. So I arranged to provide incentives for the members of the team who could not participate on work time. The incentive is a grocery card in the amount equal to about 2 hours of pay received on average by the rest of the members who can participate on paid time. Those incentives are given out for each meeting that's attended. And I accidentally committed to making those payments before we had a funding source for them, but thankfully my supervisor backed me up. And so we're using department funds to pay for those. I feel it's really, really critical to have peer specialist positions employed by our agencies. I think those positions are invaluable to truly engaging our clients as partners in our mutual work for their benefits. I have to say, the probation department, the Sonoma County Probation Department, does not currently have paid peer specialist positions. I hope someday we will. The agencies we work with do. And I also think it's really critical to include people with lived experience who do not work for organizations, because I really think they ground our work in the day-to-day reality they're facing. They keep us abreast of changing conditions in our community. And of course, they're the experts on what works well and what doesn't work well for them, including including them has social justice implications. And so to close now, I feel that to work with peers and clients who are not employed by organizations does mean more work for us. We need to make room to accept them when they are able to come to the table, and that won't be always, and how they are able to come and present themselves. And because they're not immersed in our lingo and system speak, it probably means reaching out to them outside of meeting times to explain things. I think that's important just to build relationship and trust anyway, so they can present themselves freely as possible. And I also might do things to engage them that I wouldn't do for other colleagues, such as texting them with meeting reminders, in addition to the email I sent to all team members, just as a small example. So that's what I wanted to share. Thank you.
Absolutely, Alison. I think that you're beautifully talking about how you really set the stage in a way to allow for meaningful participation for people with lived experience in some of your work. And I think I want to follow up with a follow-up question there. And you touched on this a little bit, but different organizations have varying missions and mandates, and there's a continuum of approaches to how organizations are doing this work. And we don't think there's necessarily one right way to do it. So could you talk a little bit about how your agency began to change how it operates so it could bring people with lived experience into the work, and really who drove that change and how did that begin?
Yeah, thanks. Well, fortunately, we had a boost from the legislators in California who passed legislation in 2011 that requires the use of evidence-based programs with people on probation. So many of the probation-related evidence-based programs emphasize creating a more collaborative relationship between probation officers and the people they serve and developing rapport. So I think that helps to set the stage. Our current chief, who's been in his position for about 5 years, he's a very strong proponent of evidence-based programs and more collaborative approaches to community supervision. That's great. One of the first things the chief did was to establish the team that I'm now on, the program planning, implementation, and evaluation team, and that helps to promote this type of work too. And then I mentioned that we have evaluations and monitoring tools and survey tools to really get the voices of the people we serve. I forgot to mention that our JMHCP implementation team is currently working on a tool to get feedback from current participants in the program. So then I guess one last thing I would add at this point is that our department's cross-agency work exposes us to different styles of working with clients, and I think that's been really good for us. But I want to emphasize, I don't think it's necessary to have a champion of client voices in leadership to start this work. At the beginning, I think it's enough. It could start at a lower level like mine or somewhere else. And I think it's enough just to have leadership that has your back, or that at least doesn't put up obstacles, and just getting started will help lower the resistance to including people's voices.
I don't know that I would call your level lower level, Alison, but I appreciate what you're saying about this can be coming up from the ground. I mean, I hear you out there saying you're going to pay people before you even know where the money's coming from. And I think that kind of, movement forward is what you can really do, or what you have been able to show that you can do. And that's great. So Christina, I'd like to turn to you next. You've done, as we heard from your introduction and from the answer to that first question, you've done a lot to bring the perspective of people living with mental health conditions to inform programs and policies in New York City. Can you tell us about how you've been doing that work and your experiences as an advisor on many, many New York City initiatives?
So as my capacity as New York City advisory on several government groups, what I learned first was to do my work is that I realized I had to listen to the community first. Peers, people who look like me, talk and think like me, our voices need to be heard. And I use my stories and their stories to figure out, like what Alison said, what worked well, what didn't work well, to promote policy change. Often a challenge that I had in the government spaces in the advisory role was that usually a few peers were in the room at a time, and only one Black peer, usually myself, was at the table. There were no powers in numbers when it came to peers, but diversity and inclusion wasn't really factored in when it came to peers, and I felt powerless. However, one of the good moments that I did have is when we, as peers, was working at CCIT, which I mentioned earlier probably. After 3 years of peers advocating at CCIT to push the mayor and NYPD to launch crisis intervention training, which is a training that educates and teaches police on crisis communications and de-escalation techniques when dealing with people of emotional crisis. That took 3 years to advocate, and it took 3 years of peers actually working hard together to influence policy change. But despite that change of changing police, countless people were still being killed by police. And so now, like with my work, which I'll discuss later on, was the PCIT training, I decided to launch a person-centered intervention training, which is a peer response training to mental health calls.
That's great. So I think then, just my follow-up question for you is, could you tell us a little bit about that training? I know, it's a new model around mental health crisis response that combines person-centered or peer-led training and crisis intervention. You launched it this year, but could you tell us a little bit about that program, why you designed it, and really what advice you have for people who look to design similar models in their own communities?
So since peers were really at the table and our voices weren't heard, I decided to, instead of complaining, I was going to take matters into my own hand, right? And so I created the person intervention training mental health response pilot and partnered with New York City Parks Department, Fort Greene Park Conservancy, which I'm the treasurer on, and Fountain House, which is a clubhouse in Manhattan that supports people with mental health concerns. We partnered to have this pilot, which I trained this team of people, which were with peers and park officers, the whole park team, Fountain House, on how to respectively engage with park patrons when they are well, becoming unwell, and in crisis. We spend so much time talking about crisis. We need to talk about prevention and intervention as well. And the goal of my PCIT pilot was to connect people to divert people from the criminal legal system and to connect them to services. The peer-driven response is basically having We got 8 peers on staff, and they work from Monday through Friday from 7 to 12 and from 6 to 9 at night when we have the most frequent, users in the park. If you cue up the video now, you can hear from one of our peer workers. Thank you.
That'd be great. Kaya, are you able to cue up that video for us?
Yep, I'm doing it now. Does everyone see it on the screen?
Yeah.
Okay, great. I'm gonna just increase and then start it.
It's a very rewarding job to me because I like helping people. My job basically is to go around asking and helping anyone that needs our help. That's why we're called a social well-being team. We're not allowed to kick them out the park, tell them they can't use, but what we can do is ask them if there's any help as far as their homelessness and their substance abuse, about putting them in detoxes, putting them in shelters, and whatever they allow us to do. If you say this what you want, I can make it happen. When I see them passing through, they're like, hi, and I'm like, hey. And I seen a guy that I work with, and one day he finally came to me. He's like, could you please help me? I was like, help you do what? He's like, I really need somewhere to go. And I said, you serious this time? He said, yes, I am. I really need to go in because whatever his problem was, I said, I got you. I don't let nobody hug me, but I let him hug me because I know it was genuine. And he said, I'm staying, and thank you so much. Sometimes all they want is somebody to talk to, and maybe they really do need help. They just don't know who to ask. You have to have compassion with this kind of work and understanding.
So yeah, I get emotional when I see that. I'm sorry. Because all I wanted to do, since I didn't have the supports when I was growing up and in my community, I just wanted to always give back because I hate to see people suffer, and systems are so broken. And so, I could share two experiences. Like Monique, she's one of my peers. She works in the morning from 7 to 12. There was a woman who was homeless for 5 years. She had DV issues. She was on substance use issues also. 2 weeks ago, we were able to connect her to an SRO to help her. So now she gets supportive housing, which I'm happy. There's another guy in the park who's been homeless for years. We get him clothing. We got him connected to a substance use center for rehabilitation and mental health. So I'm very happy for what I'm doing. And I encourage everybody on this Zoom to also do. If you could give out the help to community, do what you can. Thank you.
Christina, you do not need to apologize for getting emotional. This is deeply held, personal work that means a lot to you. It means a lot to people who encounter these services. It means a lot to our communities. So I want to just say a big thank you. I know you've, for a long time, as you said, been holding down this fight in New York City and pushing the envelope from CIT and beyond to this new model. And so I just really want to thank you for that. And thank you for sharing that. No apologies necessary at all.
Thank you.
And I actually also think that, that focus on the intersection between housing and lived experience and systems, and how people who themselves have experienced houselessness are involved in system transformation is a really nice transition to you, Anthony, because what we know is that in supportive housing and human services, peer support is an important component of recovery and thriving, and people with lived experience are increasingly an integral part of that workforce. So Anthony, you're working in supportive housing, managing peer support specialists. Could you tell us about your journey and some of the challenges facing you and your team in those roles?
Oh, wow. How do I follow Christina? A little bit about me is that I grew up with 6 sisters and 1 older brother, and I grew up in a home with the mother and the father. I had a wonderful childhood, and they tried to shelter me from the streets and what's going on around the corner. Long story short, I found out what was going on around the corner. and I got involved. And before you know it, I became an alcoholic by the time I was 25, addicted to drugs, no longer wanted to follow any one rule. So I lived by the code of the streets. Addiction took me places I didn't want to go, kept me longer than I wanted to stay, but when I finally decided to get my act together with God's intervention, and folks constantly reaching out and praying for me, I decided to make a change. So I got on a wait list for housing. And once I got housed, all I wanted to do was stay sober and not be a part of the streets anymore. So I told myself, I'm gonna do everything, whatever it takes, not to go back to the streets, not to be in and out of jail, not to be homeless or on drugs. So with that being said, I had to change my way of thinking. So I said, I'm gonna just work on me. I cut out what I thought was friends, what was come to find out they were just associates. So I moved into one of the Skid Row Housing Trust buildings, and they had the groups. They had self-help groups. They had all kind of groups. So I kept getting an invitation to the group. I'm like, no, that's not me. I'm not gonna sit in no circle and share my feelings. I'm from the streets, But once again, I had to go back and talk to myself like, hey, you said you was gonna do whatever it takes. You said you're gonna do the opposite of everything you've been doing. So I started going to these groups. I said, okay, I'm gonna go to these groups, but I'm not gonna share. But the more I went, the more inside me, because part of my journey and reason for trying to, the reason I ended up on drugs and being alcoholic was because I was too busy trying to fit in. I had a wonderful family where I fit, but I wanted to fit in with my peers that I seen on the streets. So I never got a chance to know who I really was. So now it's time for me, now that I'm sober and I'm in my own place, it's time for me to figure out who I am. And that was so scary, but I got connected. I started going to a drug outpatient program just to learn about addiction. I didn't know nothing about addiction, what I suffer from, why, none of that. So I connected with a drug counselor and he was explaining all that. I did the 12 steps, all of that. And he just suggested get a therapist. Now, where I come from, you don't talk to no therapist. You talk about it in the house and you talk about it with God. And even today, me and my mother laugh about it. I'm like, Mom, you were supposed to get me a therapist a long time ago, She's like, boy, that's how I was raised, So I got a therapist and we uncovered everything I discarded and buried. It all came to the surface. So, images and ideas and everything. And she diagnosed me with PTSD. I'm like, I've never been to the war before. And she was like, yeah. Them streets was a war, you can get PTSD just from being in a car accident, just for witnessing a car accident. But I seen some things and, so I'm steady working on me. And that's how the trust was like, okay, they seen me work on myself. So they're like, you'd be a good fit for this position we got, So I just wanted to be sober and watch Jerry Springer all day, I was a welder by trade all throughout my addiction. I can get an apartment and a job, but I just couldn't keep neither one of them. So I'm thinking, okay, I'm gonna just stay sober for like 3 or 4 years and I'm gonna go back to being a welder. But God's like, I was in my addiction and my homelessness I was in my addiction for over 20 years. And I was homeless for about 15 years, 15, 16. So God told me, I didn't bring you this far for you to sit in your own apartment and watch TV. So I got some things for you to do, like they said, a job not gonna knock on your door. A job literally knocked on my door, and I answered it, but I told them I'll be of service as long as y'all need me. So I was being of service. Once you get it connected to an apartment, I would assist that person to the Social Security building, the DMV. At that time, they had to take a TB test. So I go to the clinic with them and, and talk to them about, you're going to be housed in a minute. You're going to have your own apartment. This is what it's going to feel like. So the more I did that, the more I forgot it's becoming a job, right? So one day they say, okay, you're gonna be in this room, and it just happened to be a computer in that room. Because I told them, once this feel like a job, I'm gonna quit. Because I was already approved for Social Security. So, but they put me in this room with a computer. They say, okay, this is your email address. I'm like, wait, hold up, this is a job now. But by the time I realized it was a job, it was too late. I was too busy enjoying helping other people just like me, putting their mind at ease, because they think, okay, yeah, I was matched to this apartment, but there's no guarantee I'm going to get it. I'm like, it's up to you. If you say yes, it's yours. If you say no, then you just keep waiting, But my job was to put their mind at ease and let them know it's going to be. Like, long story short, after years go by, I started creating my own groups, and it was about life skills, because some folks been on the streets longer than me. They forgot how to make a bed, wash a dish, mop a floor. So me and my team, we're gonna do this. This is what we're gonna do. We're gonna go in your apartment and teach you, because some people move in and the buildings are so nice and so clean that they move in that they waiting, because in and out of these shelters, you always on a time limit. Time to get up, time to go to bed, time to eat, time for this. But now, you're on your own time. You come and go as you please, It's not going to work with everybody because of where they at, but we meet you where you at, and that's where we go from, And we house within. Once we see someone else, like me, once we see someone else been working on us, they be like, hey, you want to be a peer? And a lot of people would take it and be good at it, but they want to hold on to their income, their Social Security or their GR. It's like a comfort blanket that's guaranteed income, and they don't really want to make the transition of, getting a regular paycheck. So a lot of people turn it down, and that's fine, but they continue to be peers. I think one of the most important words that I learned is empowering. Learning to empower someone else just like me, because for a long time I was getting invited to, like, when we get a new CEO or CFO, whatever, I'm always invited to the table. They want me to have lunch with this person, and they want my opinion on, do you think he would be? So it took me a long time to feel like I belong. So that's what we spend a lot of time now, letting the other peers know you belong. If they invite you, you belong in that table. You're probably the most important person in that room at that table. So you go and you get comfortable, and
Yeah, it sounds like you made space for yourself at that table, Anthony. I mean, you're talking about people invite you in, but you made real space for yourself at that table. And I think that way you told us about your transition from being served at Skid Row Trust to really working to help other people. What I hear is that you made that space. So I just want to thank you for that. And just one quick follow-up, and I am looking at time. Also, I'm just recognizing, I want to make sure I get to Marcella. And for the folks who are listening in, if you do have questions, please put them in the chat. I'm going to try to get at least a couple minutes of question and answer at the end. But Anthony, one quick follow-up, and if I could ask you to keep it just a little short. You've mentioned this a little, but one of the grounding principles of this work is that people should be paid for their time and expertise. Sometimes that's easier said than done, and you kind of talked about this tension. Organizations are really trying to grapple with how to both value people's contribution, but also not to jeopardize any public benefits that people might be on. And it sounds like you're having that same challenge with folks who you're looking at who might be peers. So could you tell us how you're approaching those issues and any advice that you would have?
We allow them to make their own decision. We put it on the line. We tell them what they're going to make. This is what you're going to make. You're going to have regular hours, and we let them know what it's going to be like, and it's their decision. And they'll take it, and they might work 3 months. But then when Social Security, when it comes time to make that decision, we sit down and talk again, and we be like, well, what are you going to do? What do you want to do? And it's hard for a lot of people because along with becoming a permanent employee, living in the permanent supported housing, your rent go up. So a lot of people have to look at that too. And it's kind of scary for some folks that's not ready to move on, because it's like, oh, if I make too much, I'm gonna be forced out. I'm gonna be forced to go find somewhere else to live. So that kind of deters a lot of people, but some people just ready to take that leap of faith. And to go back to what helped me get to this point was I had to create a support system, the positive support team in the beginning that's going to push me and continually tell me that I belong, because they would open the door, but I wouldn't always go through it. I'm the type, I would look in the door and it was always somebody to push me. I always need that extra nudge. So, and I happen to fall into a great organization that respect everyone as the same. Whatever training, peers had to go through a lot of training. There's so much to being a peer, because there's a lot of trainings we have to go through, and we have to understand our own triggers, because we don't want to go and try to assist someone else and their situation trigger me, and now I'm no good to anyone. And so it's a lot. So yes, pay us. I'm sorry, people should be paid what they're worth.
Thank you. Put a pin on that comment. Yes, put a pin on that comment. I like that.
And know your worth too.
And know your worth. Yes. Thank you so much, Anthony. Marcella, I'd like to turn to you. You mentioned this some in your first, your opening, but Away Home America has an explicit mission of centering young people experiencing homelessness and determining their own future. And it's led and staffed by people with lived expertise. So Marcella, could you talk about the gap that Away Home America was conceived to fill and what it has taken to grow your organization?
Yeah, so, Away Home America has really been positioned by leaders in the movement to end youth homelessness to exemplify what transformative work looks like, to lead the movement with our, what we truly believe and how we've been putting in action to really end youth homelessness at the forefront, so that people can follow that lead and incorporate those same things. And so just the fact that we've, we have staff, our leadership body, my position, where we're shifting this power has really been a good example, in that charge to lead the homelessness movement in moving forward and doing the same thing. And so we're also not only just pushing transformative efforts, but also reformative efforts. Like all of this ending youth homelessness can happen through reformative efforts that transition into transformative edge of reform into transformation. So all of these efforts combined get us where we need to go. And so Away Home America has really been doing the work to, again, just exemplify and epitomize what that is supposed to look like for folks in the movement. And it's been really scary. I would say it's been scary because when I walk into rooms, I'm not like one of many young people that are like directors. I'm in the room with like older adults that are, directors, been directors for so long. And so there's still that like majority and minority, that I think the movement has to be really mindful of as I'm walking the room. And I think has done a really good job to do that. And it leans into like this piece of accountability too, that really like fills in gaps as well. Because a lot of times when you've got a lot of people that really are on the same page and kind of have the same viewpoints, like not that accountability is not there, but it's not as like, hey, accountability check. It's not as prevalent as it needs to be. And so I think just like having me be in the position I am is a constant reminder of accountability in the work that we're doing. And Away Home America has offered that. We'll continue to offer that in the movement.
Thank you. And Marcella, since your organization has done such good work here, for other organizations that are interested in centering people with lived experience in their own work, how would you recommend they begin that journey?
Yeah, I think that's a really good question. I would just say like, part of my suggestions, like I could write a whole book, maybe a mini series about like what I think folks could do to get started. But I think in the way that Anthony just shared and was super vulnerable with information that's pertinent to like people's programs in different ways, like slowing them systems and people in systems being able to slow themselves down to really digest that and understand that and like live in those moments, because we have those moments and like we need those moments in order to give the perspective that we give. And so I think like because the work field and the workplace is so like get it done, it's like, oh, this is time sensitive. Oh, we've got to do this. We're on this grant timeline and this timeline. And it's like sometimes you really got to slow it down. And I think people have to be more vocal about being able to slow down and be open to the vulnerability, but not also open just to hearing our vulnerability, but being vulnerable with us. Because let's be real, one of the biggest things that I've been really pushing in the movement to end youth homelessness is like, look, this is not a us versus y'all thing. Y'all are not working for your clients right now. You're working for yourself and your neighbor. So like, even forget your neighbor, get a little selfish. Nobody likes the high rent and the high mortgage payment. No, we don't, none of us like this. We all should be fighting against it. So it shouldn't just be, oh, that's a them problem, because anybody can end up homeless for at a blink of an eye. Somebody can lose their job. We've seen through the pandemic how the pandemic has been an equalizer. It has humbled a lot of folks, you know, that were on this high, you know, I'm making the salary, I'm getting all this stuff, and then bam, pandemic's like, sit down. No, now you look just like those people that you was talking about and didn't want to help out or didn't want to vote for somebody that would help them out. Or so it's this reality that the pandemic has really, you know, given to us all. And I think that like that we should strive forth with that. I think that that's something that should have been original, like from one human to the next. But we see, you know, material things and power and positions make people feel like they're better than other people. And some people feel like they're lower than others. And I think we just have to really like get away from that idea and like be realistic about like what's hit us. Or we're gonna have a situation like we're having now where it's like, you're gonna eat this humble pie regardless if you want to or not. And so I think like that's important. And then again, with the accountability piece, for me, accountability is so important. And like, I'm just gonna say from human to human, it's a hard thing for people to digest, but it's an important thing for people to digest as we're trying to grow. And if people want to grow into this, you know, including people in the room that have not historically been included in the room, and if they have, it hasn't been in the right way, you know, if we're gonna alter that, like we have to really get real and sit with the ugliness of it all and like really be willing to change it. And, you know, when somebody speaks to us, because it's almost like I've always been like, oh, tell us the lived expertise. But when the people in power don't like what I got to say, when it doesn't feel good, when it doesn't look good on their numbers or on their reports, let me just muscle that out, get that out the way and go the way that looks best for me. That's going to get me this grant. So it's a lot of lying and it's a lot of BS that doesn't need to be here for all these people that say, I just want to help. If you want to help, hold yourself accountable and do the right thing.
That's powerful, Marcella. Thank you. I see that we're getting a little bit towards close to time, and there were a couple questions that actually came up in the chat. So what I'd like to do is move towards those. The first question that came up, if I'm tracking, I might have missed something, so apologies if I did to the audience, but looks like we've got a question from John. What was it like the first time that you were invited into the space to provide your input? How did that come about, and who invited you in? I think that question actually could go to any of the people on the panel who identified themselves as having lived experience. So maybe if folks want to respond in just 1 or 2 sentences really quickly, maybe I could turn it to each of you in turn. Christina, could I start with you?
With me, often I wasn't invited. I just showed up. Once there's a meeting, just show up and that's it.
I love that. Anthony, can I turn to you?
I was invited by VPs and other higher ups because my name was ringing so much with residents and other folks. So I was invited by them, and you know, with me, it's like, you know who I am, you know where I come from. So whatever I say is gonna, whatever come out. This is what y'all want, okay? You know. So I was invited by some more uppers.
Thank you. And Marcella.
Can you ask the question again, Ayesha?
Yeah, absolutely. Sorry, I'm scrolling it back up. What was it like the first time you were invited into the space to provide your input, and how did that come about, and who invited you?
Wait, one more time, because it cut out.
Sorry about that. Sure. What was it like the first time you were invited into the space to provide your input? How did that come about, and who invited you in?
Got you. Okay, so I was 15 and I was in foster care, and I seen this group of young people who were, doing this event. And my social worker was like, yeah, well, let's go to this event early on a Saturday morning. I was like, okay. So I went there and I seen all these young people just being the boss. I was like, honey, this is where I need to be. This is it. And so that's what really got me started. And then from that point, I was just, introduced or brought into decision-making rooms and, talking to so many different people. So I would say like a combination of people inviting me in the room. But I think that the experience was really good because I was able to see other young people like me. It wasn't just people that were like, hey, yeah, come on in here. It's safe. Like, it was young people that were like, yeah, it's for real safe. Come on,
Thank you. Well, I'm going to do a little bit of a dangerous thing as a moderator because we've got exactly 3 minutes, but I want to kick one final question to everyone on the panel. So if you could try to keep your response to maybe 45 seconds or less, which I know is not easy because this is about to be a big question. But if you could bring us home by sharing a sentence or two that describes what the future could look like when our organizations and systems truly center people with lived experience. I'd love to end on that note. So just a sentence or two that describes what the future looks like when our organizations and systems truly center people with lived experience. And Christina, I'll turn to you.
What it looks like in the future, people having equal pay, people having supportive housing, people having culturally competent doctors and care.
Thank you. Anthony.
What it would look like? Wow, I guess it would look like the streets are more emptier from tents and all, along with the equal pay and everything Christine just shared. Bless you.
Thank you. Thank you. Alison.
I think our policies and programs will be more relevant, be of higher quality, be more effective, and those of us in government agencies will be better stewards of public funds. And at least as important, our clients will feel heard and respected.
Thank you. And Marcella, can you bring us home?
Yes, I think just to agree with all the other panelists and what they said, I think it will look like that. And I also think it will be us still navigating any flaws that come out of any new systems, because we're humans and we're not going to be able to make a perfect system. So there's always going to be a need for folks to make sure that we're accountable and we're always doing the right thing. And so I think that's also going to be in our future. Well, the beauty of it and the ugliness that we'll be fighting against, but it won't be as thick, I guess, and frustrating as now.
Thank you all. That concludes our Engaging People with Lived Experience in System Transformation panel. The recording will be available online, and once it is, please do share it with your partners and networks and spread this information widely. I want to say a very, very deep and heartfelt thank you to our panelists for sharing their work and sharing their lives and sharing their emotions about this deeply needed. The work you all are doing is deeply needed, and I just really want to say again, I appreciate you for that. Thank you everyone for attending the Zoom. Have a great rest of your Friday, and happy holidays to everyone.